in some circumstances. But we're going to talk about promoting the faith. I think this is dawah right here. The religion of Islam teaches helping the poor. In the month of Ramadan, not only is this a time of great introspection and reflection, but this is a time to become sensitive to the needs of the poor. As a very young man, my mother and I spent a short period of time in the shelter. And during that period, I saw many Vietnam War vets in that shelter, Salvation Army shelter, still there in Indianapolis. And for me, I don't think that we do enough in terms of meeting the needs of the poor. In my district, we have many great hospitals. We have Indiana University. Their cancer research efforts are great. We have Wishart Hospital. We have Clarion, St. Vincent's, and we also have a few physician-owned hospitals. Now, these physician-owned hospitals provide wonderful services to our constituents, but there's a problem because some critics say that how can physicians own hospitals and not be concerned about the bottom line? And as a result, criticism has peaked because some say that the physician-owned hospitals aren't providing enough charity care. This is a problem. At the end of the day, most of us in this room are educated, come from great universities that are noteworthy, worthy to brag about. But the reality is this: 80% of Americans are without college degrees. Some will never go. People don't care what school you went to, because at the end of the day, if you aren't concerned about their needs and their suffering, what you've done, how you've matriculated, where you've been, doesn't mean anything. If we're not concerned about the least of these as spoken in the Bible, Prophet Isa, peace be upon him, said to his disciples in a meeting one day, he said, "He who wishes to be chief among you shall first be your servant." We must get back to serving people. We have to get out of this political battle and these emotional battles of Pakistan, Afghanistan. Though critical, we have to keep our attention on them because they're very critical. We have to get beyond the emotionalism, though critical, of the Middle East, though we got to keep our eye on it. But if we want to affect change, we have to start here at home. The reason why we're not really connecting as Muslims in this country is because people see too much attention, arguably. Yeah. Across the seas. Now, I know that there are dual allegiances. I respect that. But one of the things that I hear a lot in my district is that, with so many qualified Muslim physicians, why aren't they out on the forefront in this healthcare debate? I wish I could take them to see this. This will probably be YouTube. Probably not a good idea. My opponents will use it, but the Muslim brothers help you out. They hurt you, but that's all right. But at the same time, a lot of people say, why aren't the Muslims out on the forefront of this issue? A lot of Muslim brothers and sisters who come from the Republican Party, quite frankly, could be speaking up on this issue, serious concerns. My district, overwhelmingly, a poll was taken a few weeks ago. The headline read, "Congressman Carson all alone in the healthcare battle," in relationship to my colleagues in the congressional delegation. Overwhelmingly, my district is for a public option. Overwhelmingly, my district is for a single payer. We're a little different there in Indianapolis, but overwhelmingly, they're for a public option. And that's critical because I have Eli Lilly, one of the largest drug companies in the world, headquartered there. WellPoint, headquartered in my district. Two of the largest employers in my district. Another large employer in my district, hospitals. And so even with these two juggernauts in my district, and we love Eli Lilly, they do a great job in terms of their innovation with biological meds and those kinds of things, and diabetes meds and medicines for mental illness. My mother suffers from mental illness. But even the district is for healthcare reform. I had a great time in August. Not only did I get to go to Iraq and meet with our troops and travel to Kuwait. When I was in Iraq, I met with a U.S. citizen, a troop, who expressed to me, one of my constituents, he said, "I fear when I go back to the States, Congressman, that I'm going to have to take care of my mother." I said, "Why?" He said, she suffers from a pre-existing condition. She suffers from mental illness. And because she has a pre-existing condition, she can't get coverage, or the kind of coverage she needs. That's problematic in the wealthiest nation in the world. Here he is defending himself, defending his life. He went to the military because he didn't have any options. Young brother wanted a degree, family couldn't afford it, didn't have any other options, could have joined a gang, could have joined a supremacist group. He joined the military. Now he's over there fighting, he doesn't know why, but he has to come back and take care of mom. That's a problem. This healthcare debate is so critical. As members of Congress, we have our specialties. I come from marketing background, law enforcement background, intelligence background. I'm not a physician. As elected officials, you have to master generalities because so much is coming at you each and every day. What I make an appeal to you all as experts to reach out to us, to educate us. I meet with physicians all the time. But you guys have a different perspective because you've seen poverty abroad and at home. You have a different kind of insight than we need. You have friends on Capitol Hill, but as Kucinich said earlier, if you're not engaging us, then you'll get lost in the shuffle. I think what you guys are doing, you're doing a phenomenal job, but we need a movement. Movement changes things. It's not enough for us to meet today. You guys make a report, go through your Roberts rules, and then we dismiss and do something else. We have to keep this thing going. You have some great leaders here who have access to mobility. Where's the Muslim sister up here? Respectfully. That needs to be posted on YouTube because we're fighting a PR battle at the same time. While we have experts in healthcare, we got to have a hijabi or at least a Muslim sister up here who's a physician or a nurse to represent the cause.
She's going to come and testify.
She better get up here double time. As long as that camera's on, she needs to be sitting up there. See, I'm a politician and a marketeer, and I'm sensitive to perception.
Sure.
So many people come in here, non-Muslims, wanting to know what's going on. They say, oh, chauvinism, sexism again. I'm out of here. I'm going to lunch. And we've lost the sale. See, so I want to thank you guys for what you're doing. I'm pressed for time, but I really want to go deep because I really want to know individually from each and every one of you because I'm sure you all differ. How do you feel about public option? Is it realistic? What do you think about co-ops? What do you think about single payer? Is it realistic? Is it a bunch of political talk? What do you think about a trigger? Letting the insurance companies do as they do, and if they don't meet the requirement, then the public option will kick in? Or is it another attempt by the insurance lobby to raise the bar, knowing that the insurance companies will never meet this, so they can do what they've been doing? We got to talk about these things. I want to know what you guys are thinking on these issues because I have to take it back to my constituents in my district. We have Muslim physicians who I've met with in my district and who I talk to, and you know, people are different. And I understand that when we talk about Gaza, causes a lot of emotions. The Muslims, large part, people think they aren't going to do anything. We talk about disparities in Pakistan. Muslims get excited, but they aren't going to do anything. The same physicians in my district who we've tried to engage, some of them, you got Harun Qazi and some other good people. But for the most part, they just want to live their lives. You see? We have to do more than just live our lives. We have to be active in the America that we claim to be proud of and a part of. Though problematic, though not perfect, arguably the greatest nation in the world. So I'm appealing to you once again to be a resource to me, to be a resource to us, to Brother Ellison and others, in educating Kucinich and educating us on what your concerns are. Because we can say, you know, we're here as physicians or here as medical experts, this isn't about Islam, but when it says the American Muslim Taskforce, how could we not incorporate the deen in our discussion? So I want to thank you and commend you for what you're doing. Keep up the great work. But remember, keep in mind, before we're too critical of elected officials, we are masters, or at least trying to master generalities. If you want specifics, there are a few physicians who happen to be members, but if you want specifics, we got to come to you guys. So open the door and educate us. Assalamu alaikum.
Because without health, all of the other rights that you would hope to enjoy could not effectively be enjoyed. And furthermore, to point out the importance of this idea of promoting the general welfare, the founders further put it in Article 1, Section 8 of our Constitution as being one of the principal reasons